6:11, and we are starting our board meeting. All right, so we will start with the Pledge of Allegiance. Okay, Sheila, if you could call the roll, please. Ms. Bernard?
Here.
Can you state your location, please?
Sorry about that. In Oakland County, Michigan, Birmingham.
Thank you. Mr. Cohen? Mr. Furman?
Present in Troy, Michigan.
Dr. Hans? Mr. Landsman? Mr. Lindermeer?
Here.
Ms. Namie Dyer?
Present from Farmington Hills, Michigan.
Ms. Newman? Ms. Root? Here. Dr. Todd? Mr. Torres?
Here.
Dr. Guadalupe? Here. Next item on our agenda is approval of the board meeting agenda. Is there a motion to approve the board meeting agenda?
I make a motion to approve the agenda.
And a second?
I would second that motion.
Thank you. Any discussion? Seeing none. So we will move on to our Stories That Inspire Hope. We have folks from Sacred Heart Rehabilitation Center with us today. Virtually, yes. Oh, Easter Seals. I'm sorry, I've got the old agenda. My apologies. Sorry, Easter Seals. So we have Brent Worth, our President and CEO of Easter Seals, and Uriel Stevens, Director of Family Services.
Hello, good evening. Can you guys hear me? Yep.
We can,
Yes.
Thank you.
Awesome. Good evening. Thanks to the board and thanks to Oakland Community Health Network for inviting us to present tonight. So you did introduce us both already, but we are going to talk a little bit about Easter Seals, and we're going to talk a little bit how our partnership greatly improves the community. So we've been here, we're an affiliate of Easter Seals, and we've been here in Michigan since 1920. So we celebrated 100 years last year. If you want to look at the agenda, if you want to click through to the slide, next slide. We're going to share, we're going to share some success stories of some of the families that we serve. They've did some pre-recorded videos. We're going to talk a little bit about who we are as an organization. We're going to talk about the mental health crisis and how it's impacting staff at a high level. We're going to give some perspective on some specific services that we provide. We were asked to provide some details on our partnership around kid services. So we're going to talk a lot about that and how we best partner in Oakland County with our CCVHC efforts, and that we're really excited to partner with you on, and some early intervention and some community needs. So that is our agenda. If you want to click to the next slide, which is our success stories, we started that off. That is early in the presentation. So Christina and Sheila, I think, have control. I don't know exactly who has control, but.
Easter Seals has been really great for my family, especially my son James. Our therapist and our psychiatrist have been wonderful working together to communicate with school, with home, teaching him skills that he can use out in the community. He's come a long way, believe it or not, right? He's come a long way. He had some troubles at school, and Easter Seals was able to intervene and find him the proper care that he needed through other resources. I have had times where I've texted my therapist and said, I don't know what to do, and she called back instantly. Set up psych reviews, med reviews that weren't scheduled just because it was an emergency and we really needed to be reevaluated. So all around, it's a great program, and they've gone way out of their way to, especially Angela, my therapist, has gone way out of her way to make sure that James is thriving in the community and at home. So thanks, Easter Seals. You want to say thanks? Sorry. Sorry.
My son and I came to Easter Seals after a really rough 2020. Not only was my son struggling with life changes, I too was struggling to cope, and our relationship was strained. Easter Seals brought me and my son together again, and is helping us both learn and cope with past trauma and regulating our emotions. Getting my son and I the help we needed has also helped me become a better mother and the mother I always wanted to be.
So who is Easter Seals? And we're going to, again, share a high-level perspective of who we are before we get into the details. If you want to click to the next slide. You know, we provided our purpose statement. This is, you know, of course, your purpose statement or your mission statement is important for every organization. But our mission is to work to change the way the world defines and views disability by making positive, profound differences in people's lives every day. And so that's important for all of our staff to know and to make sure that we live by that every single day. If you want to go to the next slide, please. You know, who we are, you know, we're a 501c3, so we're a separate affiliate from a national organization. A lot of people think that have a boss at our national office, but that's not accurate. We're our own 501c3, so all of our funding, all of our decisions, all of our partnerships are done here locally in Michigan. We cover the whole state of Michigan. You know, we put on here, we're probably one of the largest behavioral health providers as we serve over 15,000 people in the state just last year alone. Lots of growth. We'll go over some of those growth areas. And one other innovative way we fundraise, and what we do with that fundraising is we look to start new innovative services, and we can look back in our last 100 years and we're fundraising to meet unmet needs and to make those a new best practice. So a lot of pride goes into how we invest our fundraising dollars into new services. Next. To give perspective of where we're located, so through our partnership with Oakland County, it certainly is with you all is our biggest partnership. And you can see on the map here, we have lots of locations throughout Oakland County, but we also have a lot of school partnerships that we're going to talk a little later on about how our partnerships with the schools have been evolving. We also have locations in Centerline, Flint, and Grand Rapids. So if you'd like to click there, please. Next. So last year we served 15,000 people, and it certainly was a lot of growth in kids services. And we wanted to give perspective again, how together we really complement each other and partner, and with your funding as well as other funding that we're able to bring to the community, what the impact that we're able to make collectively. So last year alone, that 0 to 6 ages, we through infant mental health, through other early intervention, we served nearly 400 kids in Oakland County. 7 to 17 was nearly 1,300. Throughout the state was nearly 6,000. And then our adults, I mean, we're talking more about kids tonight, but wanted to give perspective. We're actually a larger adult provider, but we are probably the largest kids behavioral health provider in the state. But you can see where our makeup is of how we partner in Oakland. So another, roughly 6,000 adults that we serve as well. So lots of people, lots of busy services, lots of people in need, definitely with the growth of last year, and really continued growth as the mental health crisis only will continue for the next few years. Next slide, please. I just had a little fun with this map, but this really wanted to show how we bring different funds into the community. And in Oakland County, really just, you can see all the orange and blue, and that's our collective funding impact. and serving the Oakland County and the surrounding community. So lots of different types of funding goes into best supporting the community. OCHN is definitely our largest funding partner, and we are very appreciative of it. Thank you. Next slide, please. I put this on there not to really boast about our staff and retention, but to really highlight, everybody is stating about a mental health crisis that the world is in right now. And with that, a lot of new mental health providers have moved into the space of mental health. And as a result, the recruitment and retention of our most prized assets has never been as high as it is today. We've experienced tremendous growth, but with that, we're also finding it harder and harder to recruit and retain the best staff. So wanted to share that with you all, because that will be something that the providers, and you all know it hit the direct care staff many years ago, but now it's hitting the clinical staff in areas that we haven't had to fight for staff before and recruit and retain. Our turnover really has kind of flipped where, 18, 19, 20 was not in our clinical staff area. So it really wasn't our provider and social worker areas. But now it is, as more venture capitalists and more funding goes into mental health. There have some different attractive options for staff. And that's one area that we're really working hard, and we are working in partnership with Oakland on that, how best together the whole community, not just Easter Seals, but really how best the whole community and how Oakland County can retain the best staff. And I'm hopeful that these numbers next year, if we're able to present, not only stay the same, but get better, but knowing that's going to take a community effort to make that happen. So next slide, please. This is where Uriel Stevens, our Director of Kid Services, is going to take over, and I'll just make comments as we have throughout the presentation.
So last year, as we all know, we were presented with increased challenge for all of us, and especially for the persons served. So through that, we were able to enhance our services by creatively to support the community. We supplied over 400 iPads to adults, children, and families to keep them connected to services, and also to support some virtual school during the pandemic. During that time, our youth peers have developed and are providing podcasts and webinars to support anxiety, coping skills, and healthy living skills, and recognize depression and anxiety. As an organization, we were sought as an expert for media appearances to discuss a variety of topics around mental health. As you can see in this slide, we have an array of services which continue to evolve to meet the needs of the community, from prenatal to seniors, including behavioral health, substance abuse, and specific programming underneath all those categories. In addition, we offer unique opportunities such as Miracle League, agribility, and specialty services for veterans. Next slide. So our organization, in partnership with OCHN, is always looking at how we can evolve and support the community needs. Some of these services have included our behavioral health services, the Certified Community Behavioral Health Center, our infant and early childhood mental health programs, autism, and our school-based services, which we'll go into more detail in a few more slides. Next slide. So one of our goals was to really increase access for individuals to receive treatment services. So throughout this year, and with the support of the CCBHC and partnering with OCHN, we've stepped up our game by evolving our contact center, who had 22,000 calls from the community. We also launched a chat feature, which is interactive, so people can chat with our chatbot or a live person, and we supported that with 621 individuals. We were able to see people within 10 days requesting service 80% of the time. We keep increasing our number served, and we're helping support more crisis services from 12 to 24 hours. Next slide. And as Brent mentioned, we're excited to enter the next phase of partnership with OCHN and the states on the CCBHC to increase access and treatment services.
Yeah, I just wanted to add here too. I mean, you have two great partners in both Easter Seals and CNS Healthcare in already implementing the CCBHC. So we really look forward to enhancing our partnership with OCHN to make it something that's going to be long lasting and be one of the models for the future.
So in these graphs, you'll see over the past few years, we've seen our greatest growth in children's services, approximately 39% increase from prior years. And partnering with OCHN and Access Team, we were able to quickly support many of those requests for services, and that met the criteria and eligibility to obtain SED services. Next slide. Our early intervention in infant and 0 to 6 programs. So over the last 3 years, with the support of a grant from SAMHSA and partnership with OCHN, we've really continued to strengthen our services for children under the age of 6. To do this, we became an approved maternal infant health program with the state in order to provide services to promote prenatal health and early development for infants. This program complements our infant mental health program by supporting access earlier to services and addressing the at-risk population. In addition, we added evidence-based practices of the incredible years and child-parent psychotherapy to our existing infant mental health team. We're also the first team in the US to adopt a model of intergenerational trauma treatment to address familial cycles of adverse childhood experiences in helping caregivers address their own trauma. During our last year, we were able to serve 163 children and families with those evidence-based practices. Just wanted to highlight that during the pandemic, we never stopped in-person services. We continued to provide whatever was needed to children, families, and adults, whether it was dropping off food or homework. In addition, we also provided 684 telehealth services to complement our in-person work. Next slide. So as always, we're looking at how we can best address the needs in our community. We have a strong partnership with Oakland schools and many of the districts within Oakland. And what we heard from them recently was that there was an increase in substance use, which was increasing expulsions in their school districts. So we began offering Prime for Life as a diversion tool to decrease children that were getting at risk of being expelled. And during that time, we had 40 adolescents that participated and were diverted from expulsion. We also had 97% of the youth that attended the group had changed their perception of using substances in the future. As you know, many of this was related to vaping recently among students. We also heard from our advisory council, our teen advisory council, that there's really a strong need for social skill building. So we worked with UCLA and had staff trained in a model that specifically supports social skill building for dually diagnosed children with autism and SED, called PEERS. Next slide. So since 2015, we entered a partnership with Oakland schools as part of Project Aware due to the high number of students that were contemplating suicide or had completed suicide. From that, we evolved into a relationship of co-located services. And in the past 3 years, we've evolved to 8 districts, 15 schools, serving over 500 students throughout that schools. And this is an area where we continue to see growth and evolvement. And as we move forward with the next school year, returning to in-person, hopefully, we know that the need for mental health services among the students is going to be even greater than before. So we are prepared to help support those districts with screening, assessment, and getting the right care pathways. Next slide.
Does anyone have any questions or anybody want to discuss any of the presentation with us?
John Paul?
Thank you for the presentation. It was so nice to see that you guys cover such a large spectrum of people, whether it's kids or adults. And I think one of the questions I had was with the schools, the work that you guys are doing. I was coming in actually, ironically, and hearing on the radio a news story about the pandemic and about how it's affected school-age children most, as far as I guess uniquely, and then the younger kids who have that big gap in wealth, who didn't have laptops early on, right? It took a few weeks to get those things rolling out, and months in the school districts, and then the Wi-Fi's and things like that. Many of them fell behind, and they think that gap is going to be bigger, but a lot of it's falling on mental health as well. So I was interested to find out what are you guys seeing in the schools that you're working with right now that is related to that? Is there? I know you were in before the pandemic, but has there been a change since the pandemic?
Yes, we're seeing a lot more anxiety, depression, and a lot more suicidal ideation. So a lot of the youth are expressing feelings of hopeless and helpless and actually contemplating suicide. So that's another reason, with partnering with OCHN, really evolving that suicide pathway and treatment. Right now, we are doing what we're calling dialectal behavioral therapy in schools to help educate teachers in awareness of looking for those signs and symptoms, and addressing some coping skills for students.
And then just another question. Do you, I did see you had like psychotherapy for youth and for parents. So then do you guys work with the parents? Is there like some kind of parenting classes or things to help give parents respite and those kinds of things?
Yes, all of our services, that's why we say children and family services. To really meet that child's needs, we also have to address, the family needs. And we do a lot of parenting support groups, parenting skills groups, and also working with, other partners should it need that complex need of, especially if they're SED, of getting them that wraparound services, CLS or respite when available.
Perfect. Thank you.
Dr. Hans?
Yeah, I think I probably missed it. You said that you have 15,000 individuals that you serve statewide. What percentage is in Oakland County? And my second question is regarding the funding that you'll probably cover in rest of your presentation.
Yeah, so I can touch that. Roughly, I didn't add it up. Roughly a little under half is funding from Oakland County Community Mental Health Network. So roughly 16, it's about half, it's about 50%. And the funding represents closer to about 68% to 70% of our total funding. So our total funding annual revenues are closer to 42 to 45 million, and OCHN represents really about 70% of that. So about 50% of those we serve and about 70% of our funding. Give or take a few percent.
Yeah, and what percentage of the individuals that you serve come from Oakland County?
About a little under 50%. Oh, from total overall or from Oakland Community Health Network. So we provide services to people with all needs, mild to moderate, as well as our partnership with OCHN. So in the slide deck, it does give that specific example of the total we served and the numbers that we partner with OCHN. But I'd have to get that percentage, but roughly, 40% are through our partnership with you all, 40 to 50%.
Thank you.
Mr. Lindmeyer?
Hi, thanks for the presentation. I was going to address one issue, but I'm going to put in a plug for a parenting. I attended a parenting class, Parenting with Love and Logic, so I would advocate for that system. It's helped me with my kids on a number of occasions. I still use it, even though they're adult children. So I wanted you to talk a little bit about your SUD services. I'm 12 years in alcohol recovery. In my experience during the pandemic is that as we've returned to AA meetings, we found quite a few of our people that would attend our meetings that actually, during the pandemic, what we would call, went out and did more research on their alcoholism. And that was a concern to us. What that means is they went out and started drinking again because they weren't convinced that they apparently had a problem. So I wondered if you could talk a little bit about that, and then post services that you provide. We know that there is a better recovery rate if people that receive services have either in the AA system, we call them sponsors. In other systems, non-AA systems, we would call them recovery coaches. So I wondered if you could talk a little bit about the increase in use that you see, the services that you provide, and then, would you, I don't know if you have like an AA group that, people from AA that can come in and talk to people, so that when they leave your services, that they have, that they're connected into the community.
Sure, I can. So from a youth perspective, we start with really prevention, early intervention, and that whole continuum of care. So when I talked about Prime for Life, that is not only like an early intervention, but prevention, to really talk about that perceptions before use and address at-risk behavior. We do have regular outpatient counseling for substance use specific, and we do address, we have IOP, so an intensive service line where youth that are served individually and in group settings using models such as specific to substance use and abuse. We also do have a youth peer that's serves as a recovery coach. We also have that on the adult service line. And to ask about when people graduate from our services and we work very strongly with a lot of the coalitions. And in some of our buildings, they've even offered AA services. So we're really able to link that service upon discharge. And just to what Brent was saying, we offer that continuum of care. So even when they graduate from, let's say, some of our intensive services, there's still other services that we're able to provide or link them to.
Great, thanks. I appreciate you talking about, early intervention and prevention. I think one of the things that people don't understand with substance use is drinking wasn't my problem. Drinking was my solution to my problems. And a lot of times people identified that drinking is the problem, and there were so many underlying problems that I had to deal with. And if people can deal with those through services early on, that would be a great way to prevent people from finding a solution or thinking that they're finding a solution through substance use. So thank you.
Any other questions or comments for our folks from Easter Seals? Jonathan.
Thank you. And I am here. I'm remote. I'm in LA County, so Los Angeles. So just at the back door of the UCLA Medical School, which you referenced earlier, Uriel. So I want to take a moment to just thank you guys, and I appreciate all you guys have done for us, for the folks we serve. Brent, you've been involved with us. You worked here before you went there. So long history. We've had a very close relationship with your organization as a core provider, and I know we're going to continue it. So I appreciate it. You've also been helping us with, as we grew our relationship with the physical medicine along with mental health. So with OCHN, Honor, and I missed the early part of your presentation. Can you share anything more about how that's going? Because that seems coordinated care seems to be, we're early adopters, but I know it's going to continue to be in the news.
Yeah, well, thanks for the kind words, Jonathan.
Thank
We
you.
appreciate the partnership as well. Our partnership with Honor has only strengthened. The numbers continue to go up. One additional thing that we added actually during the pandemic, we used to have lab services at a location. Now we have lab services at all of our locations, kids as well as adults. So we're really enhancing our integrated care, not just on the adult side, but on the kids side as well. And really been enhancing that pharmacy and our partnership with Genoa as well. So, lots of Honor's a great partner just with us as the same with you all. And, Deb and her team are innovative and they always are trying to find better ways to serve. And, I can just say the partnership's only gotten stronger during the pandemic. It's probably the best way I can say that.
All right, thank you.
I am not seeing any other questions or comments. Thank you both for your time. I think your presentation was great and learned a lot about your agency, and I think it's important that you do take that holistic approach in working with families because, as you mentioned, if you work with the child, there's definitely other folks in the family that are going to be impacted, and vice versa. When working with parents, the children are is equally important. So I think it's great that you do take that holistic approach. Thank you both for your time. We appreciate all that you do. Have a great night.
Thank you. Bye.
And Sarah, thank you for covering for me in my technical absence here.
No problem.
All right. So before we move on, because I understand we did not have public comment at the beginning of the meeting, let's see if there is any public comment right now. There is a second period for it near the end of the session.
We did not have any public comment this evening, but I do want to remind everyone that you can add your comments to the chat, and we also have an option available on our website.
All right, thank you. Let's see. The next up is I'm looking for a motion to approve the meeting agenda minutes and reports. That would be for Committee of the Whole, for Citizens Advisory, and for Recipient Rights Advisory Committee. Is there someone who will make that motion?
This is Steve. So move.
Thank you, Steve. Is there a second?
This Eric, second.
Thank you, Eric. Any discussion on this motion? Hearing none, I'll call for a roll call vote for approval of all of these meeting minute reports.
Dr. Hans? Roll call vote on acceptance of meeting minutes for the committee. It's just a vote of accepting. Mr. Torres?
Yes.
Dr. Guadalupe? Yes. Mr. Lindemeyer?
Yes.
Dr. Todd?
Yes.
Ms. Root? Yes. Mr. Furman?
Yes.
Ms. Bernard? You might be on mute, Ms. Bernard. Mr. Cowan?
Yes.
Ms. Newman? Mr. Landsman?
Yes. I think we might need to circle back around to a few people that were on mute.
Ms. Bernard? I'm not sure. Ms. Newman is absent tonight.
Okay.
I also didn't get called.
Oh.
Sorry, this is Rena.
Miss Namie Dyer.
Great.
I'm sorry.
That's okay. Yes.
All right, well, it sounds like the motion carried. So thank you. We move on to the next item on the agenda that are the board. Well, these are the reports by the various chairs. I'll go first, the OCHN Board Chairs Report. The committee met virtually on Wednesday, March 3rd at 12 noon. It was attended by Vice Chair and Chair of the Policy Committee, Dr. Sarah Guadalupe, Secretary Adam Furman, Chair of the Business Ops would be Eric Lindenmeyer. Also attending was our CEO, Dana Lazenby, our COO, Nicole Lawson, our CLO, Kalana Ali, and Sheila Barrett, our administrative assistant. Hopefully I didn't miss anyone. The executive committee typically meets on the first Wednesday of each month. We met, discussed, and set agendas for I'm sorry, I'm reading the wrong report here. Hold on, I need to open the right one. Let's try this again. We met on June 2nd for our standard first Wednesday of the month noon meeting. It was attended by Dr. Sarah Guadalupe, Secretary Adam Furman, and Chair of the Business Ops Committee's Eric Lindenmeyer. Also attending was our CEO, Dana Lazenby, our COO, Dr. Nicole Lawson, our Chief Legal Officer, Kalana Ali, and Sheila Barrett, our administrative assistant. The executive committee typically meets on the first Wednesday of each month. We met, we discussed, and set agendas for the June. There we go. See, June committee of the meeting, the whole meeting, the regular board meeting, and as well the study session, which is later this week. Normally it's the following week, but this meeting was actually postponed by a week. And in addition to that, we also addressed what would be the stories that inspire. And tonight, as you heard, it was a good insight about Easter seals. So thank you, Brent and company. Discussion as well, the current state of COVID-19 and COVID vaccine situation. So discussion also included the hybrid meetings process and the coming back to the building, which is on the agenda tonight, the CEO evaluation process and timing, the CMHA, so the Michigan Association of Mental Health Associations, the summer conference, which occurred last week, and the ad hoc committee bylaws review, which is also later in our agenda. So hybrid meetings, as you know, continue through December 2021, unless there's an emergency order issued for where you are or where our building is housed, or unless there's further legislation that may occur. Also a reminder, board members, please RSVP yes, no, or remote via Boardable 3 days prior to the meeting so that OCHN can have ample time to ensure we have appropriate social distancing, given the number of board members that are attending. This is especially important for this coming Thursday's night meeting. Okay. CEO evaluation and timing. At this Thursday, the 24th study session, board members will be provided with instruction to perform their annual evaluation, including how to use the scoring tool. Following the meeting, board members will be given access to any materials they need to facilitate those efforts. As a reminder, this is an evaluation. This evaluation is not a team effort. Okay, it's not a team effort. Each board member is to do this on their own. Once that occurs and the materials have been turned in, and I don't remember the due date, but that'll be covered with you guys on Thursday, then the CEO Evaluation Committee, which is made up of Adam Furman, Eric Lindenmeyer, Melchiah Newman, Dr. Sarah Guadalupe, and myself, we will meet separately as an evaluation committee, and we review the evaluation scores that you all have done, and then draft a motion for our CEO's performance bonus. This motion will be made at the July board meeting for board consideration and approval. The CMHA conference, as I mentioned, it was held last week. It was virtual. Unfortunately, I was not able to attend that due to a scheduling conflict. But I am sure, like all the other ones, it is most enlightening. I encourage all of you to sign up and attend those when you can. The ad hoc committee for bylaws review. With Kalana Ali's assistance, we've drafted a motion for the establishment of the ad hoc committee to review the bylaws. This committee is missioned with the review and drafting of updates to provide clarity to our bylaws, policies, and practices to ensure that they align with current state of our OCHN organization and state regulations and mandates, as well bring clarity to both how we operate as a board and expectations of board members. So we've been wanting to do this for quite a while, so I'm encouraged by this, and again, it's on our agenda tonight. Once the committee has completed its work, the board will have ample opportunity to review the draft documents for approval. Then following adoption, I believe this committee will continue to be missioned with annual review and propose updates. All right, thank you. That is my report. The next report, are there any questions? Okay. Next item on the agenda is Policy Management Committee Chair Report. Dr. Guadalupe, please.
Thank you. For policy management, we had two folks presenting, Stephanie Wilson and Christina Nichols. Stephanie provided the quarterly update as our clinical director. The key message was that the clinical progress quarterly update of status on the annual plan and goals. So there's 3 areas. The first annual plan goal, health and wellness, the implementation of behavioral health homes within our provider network and with community partners. There was discussion on the expansion of current care coordination efforts to include more individuals across Oakland County. There's going to be partnership with all OCHN core providers and Honor Community Health to offer enhanced care coordination, including health promotion, comprehensive transitional care, and person and family support. Enrollment has over doubled from quarter 1 to quarter 2. This is being offered for individuals who meet eligibility requirements. And the outcomes are expanded reach to provide care coordination service within Oakland County. In quarter 2, there were 5 providers, up from 3 providers in quarter 1, enrolling individuals. And at this time, it's still in progress. As of June 2nd, 2021, there were 393 enrollees. Second annual plan goal is technology and innovation and health and wellness, continued implementation of complex case management, care coordination, and use of HIDIS measures. OCHN's nurse case manager assists individuals with physical behavioral health conditions that place them at high risk to assist in increasing health and wellness expectations. This can occur through complex case management as well as care coordination with the Medicaid health plans in Oakland County. In quarter 2, specific to HIDIS measure 304 related to diabetes screening and integrated health, the nurse case manager sent 325 letters to individuals prompting them to receive a diabetes screening. As follow-up per external auditing requirements, the peer navigator and nurse case manager completed 325 outreach phone calls to the same individuals. An individual is accepted or identified to the complex case management program, care coordination, and ongoing review of HIDIS measures. And the outcomes are to improve overall health of individuals receiving services through OCHN and improve persons' experience of service. This is also in progress. The third annual plan goal includes services and supports, continued suicide prevention efforts across the OCHN network. OCHN continues the implementation of zero suicide practices with the goal of improving supports provided to and outcomes for individuals at risk of suicide within OCHN's network. In quarter 2, the clinical pathway for suicide care and audit tool were updated for fiscal year 22. The OCHN internal zero suicide work group met quarterly and updated their fiscal year 21-22 work plan. A zero suicide collaborative with the provider network has met on every other month basis with an emphasis on sharing resources in quarter 2. Meetings occur on a quarterly basis, ongoing review of practices, including the clinical pathway at monthly OCHN and provider meetings, implementing strategies in the day-to-day work. Outcomes are people are receiving services that receive the highest quality support, treatment, and assessment. In quarter 1 and quarter 2 of fiscal year 21, the number of individuals on the pathway is greater than for all of fiscal year 20, with 211 individuals. And this is also currently still in progress. So thank you to Stephanie and her team for all this work. A lot of great information. Second, again, was from Christina Nicholas, and she is the SUD director, and it was a quarterly update. So Christina provided a review of outcomes for discussion about the substance use disorder, SUD, prevention and treatment department's performance outcomes. This includes service delivery information of persons living with substance use disorder challenges. It also includes justice service and diversion outreach and community collaboration information for the second quarter of the fiscal year. Again, there are 3 areas. So the first annual plan goal is collaboration with law enforcement partners. So 3 local police agencies are to embed an OCHN clinician to provide co-response follow-up for citizens experiencing a mental health or behavioral health crisis. Auburn Hills, Birmingham, and Bloomfield Township approved an interlocal agreement to commit to implementation and funding. Core team has developed protocols, procedures, and model for ongoing oversight. The OCHN position is currently posted, and candidates are being reviewed. It is anticipated that there's going to be improved connections to support with supports and services, more positive interactions with officers, and improved systems navigation. So preparations are complete, and they're moving forward into implementation of this program. Next was to conduct prevention needs assessment. So MDHHS has a requirement to determine priority issues. Strategic prevention framework model with SAMHSA and consultant. This is occurred May 1st, 2021. It provides evidence-based prevention services tailored to the needs of Oakland County and is still in progress. And lastly, annual plan of access integration. This is to make sure that when a person served calls access, a screening can be completed for mental health and substance use at the same time. They're using a phased implementation approach. This occurs daily, and the outcome is that access and OCHN's commitment to best practices, quality measures, and ensuring the person served is receiving the highest standard of care. This should be fully completed by the end of fiscal year 21. So that was a lot. Thank you, Christina, and your team for your work with the SUD. Any questions? Oh, Eric.
During the meeting, I was quite pleased to hear about the partnerships that we've developed with local law enforcement regarding mental health assistance. I don't want to put Dana on the spot, but I just wondered I think it's worth talking a little bit or highlighting if you wanted to speak a little bit about what we're trying to do.
Thank you. You know, absolutely, we want to give you a follow-up item and a full report on those activities, and the plan was to do it at our next CAL. Just to give you some insight, we have been working with the Board of Commissioners and looking for support, and then also internally looking at ways that we can expand those services and support to work with more law enforcement and the different entities. The challenge is that the way Oakland County is set up is there's a sheriff's department for Oakland County, but there's multiple communities of small law enforcement offices. So we want to make sure that we're looking at the needs across the community and really making sure that we, in every community that wants and needs that, we have the financial support to do it. The other thing that we're looking at is looking at crisis intervention training, which is an evidence-based practice, and it comes out of the national, I think it's CIT International, in which there's a 40-hour training for law enforcement officers as well to directly support law enforcement in their work with the community when they encounter someone who has a psychiatric or mental health challenge or in a crisis situation. So it's all a part of our jail diversion efforts and looking at ways that we can really own that training so that we can work with the various entities and the differences in the law enforcement community. So we don't want to just say we're only going to do it with the sheriff's department or only going to do it with certain police. We really want to own that here at Oakland OCHN and make sure that we are able to provide it and be the experts and consultants with the local law enforcement. So that is the plan, and I met internally with the team to look at what is the need in terms of internal resources and staffing. So really wanting to make it a full, solid program and not just do the hit and miss at various law enforcement offices or various counties throughout, or cities throughout this county. And so I know we have 3 in the works. I would love to see it across the county. And so the only way to really do it is to own it and be the centralized location and the experts in this area. So we have a good start, but there's some work that we need to do internally to make sure that we have the staffing and we have the training experts here. So that's what I have for now, but I would love to give additional information at the next COW so that our team can work on that.
Yeah, I'm just so proud that OCHN has taken a leadership role in at least, starting some of these processes and partnerships. It's really exciting. It's clearly something that in our community, actually communities across the country, that is long overdue. I don't know if John Paul's a court administrator. I don't know if John Paul has anything that he would want to weigh in. I think one of the reasons I'm bringing up the issue is I want to make sure that we're highlighting the good work that we're doing in the community, because I think that this is so important.
I agree. Thank you.
Yeah, I'll just touch, I thought it was exciting too to hear at the committee of the whole about the collaboration that we're participating in the 3 communities. I think it was Birmingham and a couple of other neighboring communities. Auburn Hills was one as well. But I think that we've definitely seen a movement in the right direction over the past 20 years within policing and within the courts of servicing people with mental health, the co-occurring substance use, and that's an exciting thing because it wasn't like that, 18, 20 years ago. But I think as the new generations of law enforcement, people being more open about mental health, the social movements and all these kinds of things, it all collaborates well. So I'm excited about our collaboration, and let's hope that we can implement it, because it's, one thing to create it, the second that we know is to implement, right, and then to implement it effectively. So, but that takes time and patience, but I think the big thing is that we've started it, so I'm happy for that.
If I can add too, the other thing that's really critical, and I think you alluded to, is that we have to own it here, because when you pass it to other entities and the community at large, what happens is it gets watered down. So it loses its evidence-based practice or its fidelity. So we don't want it to lose its fidelity. So we can keep it here, train the community, and then also retrain as needed. And then when there's turnover, make sure that we're connecting with those communities, that they identify, we had a turnover in our staffing, we have people that are leaving, but we want to make sure that we're on top of this and doing it based on the model, the fidelity model. So that's really critical in making sure that these things stick and really change the culture of how we look at people who are having psychiatric crises or mental health emergencies in the community, and not being arrested and going to jail, but actually getting services and support.
Thanks so much for those thorough answers. That's great. I appreciate it.
Thank you. Are there any other questions for Dr. Guadalupe or Dana at this point? All right, thank you. Next item on the agenda is our business ops report. And as well, there'll be an action item at the end of this. Go ahead, Eric.
Thank you, Jonathan. I'm going to give our Business Operations Committee report from the Committee of the Whole meeting that was held on June 10th, 2021. Anya, our CFO, made a presentation on our April 2021 financial trends with a comparison. And just so that the community understands, these are the types of reports that we give each month. And what OCHN does is we report our comparative totals for the fiscal year 20, and then we compare them with what the fiscal year 21 trends are, so that we can understand where we're going with our finances. It's really important that we do this and we report to the community on our financial status because transparency is critical to the community when we're talking about our budget. The board also reviewed the previous monthly financials that were presented on May 10th, 2021. There are 4 trends that are important to talk about. One is the revenue, 2 is eligibility, 3 are the assets, and then 4 are our liabilities. As far as revenue goes, we're still showing an increase in revenue over the previous year. Our eligibility trend is also showing an increase from the previous year, and people are not being removed from the eligibility list like in the previous years. They would be removed from the eligibility list, and so that's helping with our financial position. With our assets, cash and investments are up, and receivables are showing an increase. Capital assets are showing no major increases. Our liabilities are down significantly, but there are no major changes in employee payables or our long-term debt. So those are the trends. The comparisons from the previous years, we see that net income is up by $27 million from the previous year. Our expenses, we show no major increases, and our direct care wage will be provided until the end of 2021 calendar year, and that was an increase of 35 cents. So the direct care wage increase went up from $2 an hour to $2.35 an hour. And then number 3, our net position, that our total assets are showing an increase and liabilities are down, resulting in a positive net position. So that is my report on our financial trends and comparisons. Are there any questions? Discussion?
Eric,
No?
it's Jonathan. It's Jonathan. I'd like to bring something up. As most of you know, normally sometime this summer we have a discussion with our auditors. We will have that at the next board meeting. I believe it is at our next board meeting. But I want to assure folks that the state of our organization is strong. And I think that when we report out, or when the auditors report out, they'll also report out that both our practices and our controls are strong as well. And that's all due to the seasoned CFO we have. So anyhow, that's Anya Ison. So I just wanted people to know that, and so it will be reported out. I know typically it's been in June, but I know that with COVID we've had our challenges to get the audit out on time.
Thanks for letting the community know that, the community know that, Jonathan, because it is important that the community see our finances as transparent, and that audit report is a terrific way for the community to see exactly how our funds are being used. Thank you. The second part of my report has to do with a security audit contract, and Diana had made a presentation regarding a security audit contract. Just so that everyone knows, OCHN had issued a request for a proposal for a HIPAA security audit in February of 2021. We received 9 responses, and 4 vendors were invited for a verbal presentation. Illuminant, I'm not saying this company's name properly, Illuminant was recommended by the review committee for the following 3 reasons: experience in security audits, understanding OCHN's needs, and they had clear timelines. The first year is a much more in-depth audit than years 2 and 3. For example, a review will be done of all HIPAA policies to identify any gaps between OCHN's policies and the HIPAA privacy and security rule standards. This is not something that is required, and since HIPAA requirements don't change frequently, it isn't a cost effective to have it done annually. Instead, IT focused on areas that are either required or high risk to have completed annually. So there's going to be an in-depth security audit that in the proposal that was budgeted for $10,000, a policy gap analysis, which will be $10,000, and then penetration testing / social engineering / firewall review and 365 assessment. And for those procedures in year one, it'll cost $30,000. In year two, $24,000. In year three, $24,000. So the total will be $78,000. There will also be a wireless assessment, which is important for us to do, that will total $4,000. Then there's some travel that needs to be budgeted for. It may not be used, but that's total is $2,500. And then there are DLP additional services that totals $12,500. So the combined totals in year one would be $69,000. Year two would be $24,000. Year three would be $24,000. So it would be a total of $117,000. But what is good practice is that we have added a 15% contingency, which is $17,550, and that would be a total contract of $134,550,000. The board did review the details at the June 14th, 2021 COW meeting, and OCHN leadership is seeking for board approval for the contract in the sum of $134,550. Do we have questions or comments?
I think we have to have a motion first, do we? Or
Right.
can we?
So,
Sarah, I'll make the
are you going to
motion.
ask for? Oh,
I don't mean to jump in.
Oh, I thought that Jonathan, since you're the chair, why don't you go ahead and ask for the
all right. I'll look
motion.
for someone to make that motion to approve this security audit contract.
It's Sarah. I'll make the motion
Thank you.
to approve the contract.
Thank you. Is there a second to for this?
This is Hadass. I'll second it.
Thank you. Is there discussion on this motion?
Jonathan, I did want to add that, at the committee of the whole meeting, there was a decent amount of discussion about the importance of the security in our system here at the network. I don't think that we've done this type of a audit for, I think it was something like 5 years, since 2016. And as we all know, with what's been happening, I think we had a report recently that there have been a number of cyber attacks in a number of different ways. And I think it's fair to say that the organization and the board think it's very important to protect the HIPAA, in particular, the HIPAA information that we hold so dearly, and the community needs to know. The service recipients need to know that we hold their data as closely as we can, and that we take that security extremely important. So I think that that's important for the community to understand. Thank you.
And I was going to say something on the same vein. It every day in the news, there's something about cyber attacks, denial of services, ransomwares, uh, hacking and penetrations. So it is key for us to protect our assets because that's important, the privacy of all the people we serve and our employees and staff. Um, but as well, it's important that we maintain, because even though we are a service-driven organization, it service travels on its stomach, if you will, using technology. And if we don't have access to those tools, if our staff can't use the tools to do the job, then things get missed. Um, and when things get missed, it impacts people's lives. So being able to operate and leverage the technology is very important. Um, we know that you would think in the news that it's just for big organizations and it only happens to banks and it happens to Facebook and all, and other organizations like that. But there have been things like ransomware that have happened to organizations similar to ours. I won't say who, but it was in the news a few years ago. So at that point, I'll leave it. So if there's no other comments, then I'll ask for the
I
question.
have,
Oh, go ahead, John.
this is John Paul. I have a couple questions. So who sat on the committee, like representation-wise? Who was on the committee, or how many people for the RFP?
If I remember correctly, there were 5 people on the RFP committee evaluation. None of them were our board members, but as a rule, our board does not go through the process or the procurement process, except in certain cases where it's a direct impact to the business of the board, like selection of an auditor, things like that. Does that answer your question?
Yeah, I was just trying to figure out, like, representation-wise, from like various different departments within OCHN. What was there, like, a diverse representation of people involved in the RFP committee?
Diana, if you have that information, if you could please.
Oh, thank you.
She does have
Yes.
it.
Okay, great.
I just don't want to give feedback. That's what happens on the other side when we don't have our mics muted. We had 6 people, including procurement. We had 3 people from IT. We had someone for procurement. And then we also have Marquita Massey, who is our quality and corporate compliance person.
And then, has anybody had any experience with this organization in the past? I know sometimes we do have experiences with them, so I was just wondering if that was...
Nope, this is a new organization for us, so we're excited to partner with them.
Okay, so this is a new relationship,
Mm-hmm.
okay.
Yep.
And then I'm assuming they had recommendations and all those kinds of things in their presentation of people that previously worked with them.
That is correct. There is always a reference check.
Perfect. Okay, thank you.
Diana, would you share with the organization how many organizations bid on this versus how we got to shortlist and how we got to this one? If you wouldn't mind, please.
Yes, so we had, sorry, it was in my notes. I had the wrong notes. Give me just a second.
I think it was 9 responses.
I think it was 9 responses, and then we invited 4 back.
So a fully vetted process, John Paul. Plus, we also had our chief HIPAA compliance, so Peter was on this, correct?
That is correct. So we had our HIPAA privacy officer as well as our HIPAA security officer represented.
All right. Any other questions before we take a roll call vote? All right, Sheila.
Miss Bernard?
Yes.
Miss Namie Dyer?
Yes.
Mr. Furman?
Yes.
Mr. Cowan?
Yes.
Miss Newman? Dr. Hans? Mr. Torres?
Yes.
Dr. Guadalupe?
Yes.
Mr. Lindemeyer?
Yes.
Dr. Taub?
Yes.
Miss Root?
Yes.
Mr. Landsman?
Yes. Sounds like the motion carried.
Yep.
Thank you. Do you have anything else to report, Eric?
No, I'm done. Thank you.
All right. Thank you. All right. Next item on the agenda is the Ad hoc Bylaws Committee. And then we'll have approval and committee member appointment. I know Kalana Ali, our chief legal officer, is on vacation this week, but I also thought I saw her name on here as being part of this. So I am a big fan of not breaking into people's vacation or PTO. So I want to start with, I want to thank her for helping us draft a motion. I'm going to read the motion to help, and it defines what this committee is for, its mission, purpose, composition, the duties. And then I'm going to look for someone to take that motion and support it, and then a second for it. Then we'll have a discussion on it. All right. So I'm looking for someone to make a motion for the establishment of a bylaw committee in accordance to Article 6, Section A1 of our OCHN bylaws. Okay. That committee will be authorized to review OCHN board bylaws, board policies, and make recommendations to the full board. That committee shall contain no more than 4 OCHN board members and allow for the adoption of the following bylaw committee charter. Okay, so the committee charter, bylaw committee, the purpose is charge of the committee is the bylaws committee. The committee shall review the bylaws and board policies of the Oakland Community Health Network Board with a minimum annually, and make appropriate recommendations to the board and membership as necessary. The composition of this will be board members, and they'll annually appoint bylaw committee members, no more than 4 regular board members. The committee shall elect, so the committee itself will elect one of their members to serve as a committee chair. The duties of this bylaw committee are to meet in person at least once a year, review bylaws annually, recommend to the board the adoption of board policies as needed, develop strategies for necessary revisions as needed, submit recommendations to the board for review and approval as needed, provide reports and updates to the board regarding meetings, and support the board and or membership with interpretations of bylaws as needed. Okay, so a lot there. So I'm looking for someone to make that motion.
This is John Paul. I'll make that motion.
Thank you, John Paul. Is there a second?
I'll second that motion. It's
Second.
Adam.
Thank you, Adam. So we have a motion. We have a second. Motion by John Paul. We have a second. Is there any discussion that we need on this? Not hearing anything. I know it was pretty in-depth, but I just wanted to stress that we have 4 members that we're going to look for after this, once we approve this. So, okay, let's do a roll call vote.
Ms. Bernard,
Yes.
Ms. Namie Dyer,
Yes.
Mr. Furman,
Yes.
Ms. Newman, Mr. Cowan,
Yes.
Dr. Hans,
Yes.
Mr. Torres,
Yes.
Dr. Guadalupe. Yes. Mr. Lindemeyer,
Yes.
Dr. Taub,
Yes.
Ms. Root. Yes. Mr. Landsman,
Yes,
motion carries.
thank you. So the motion is carried. So now I'm going to look for 4 people to volunteer to be on this committee. It is not going to be an easy job. It's going to require a lot of work to go through the bylaws, through our policies, make the recommendations. Our chief legal officer, Kalana Ali has agreed to provide support to help direct and guide and advise where needed. So who please will volunteer for this bylaw committee chair? Well, who will volunteer to be on the bylaw committee?
This is John Paul. I'll volunteer to be on the bylaw committee.
Thank you. Anyone else?
This is Rena. I would like to volunteer as well.
Thank you, Rena.
This is Hadass. I would like to volunteer.
Thank you, Hadass.
Vijaya Hans, I'd like to volunteer.
Thank you, Bijaya. All right, so we have 4 members. Is there anyone else who would like to volunteer? And then we can have a vote off.
Jonathan, this is Eric.
Yes, sir.
I've got a vague recollection that Melchiah was interested.
I know that, but she is not here this evening. And
Okay.
So
I wanted to make sure that we're all aware. That's all.
yeah, and this was on the agenda. Okay. So again, it's a lot of work. I'm glad to hear we have at least 4. We have 4 volunteers. All of the board members, once the work is done by this committee, all of the board will be able to review that work, and then we can have more Q&A, more, anything that might need to be amended following that. And then we can have a motion when that work is ready for review and then for adoption. Okay, so there's a lot to go here. But I appreciate it. John Paul, Rena, Hadass, Dr. Hans, it's up to you guys to establish a time to meet and to work with Kalana to set up that meeting, that first meeting to meet and identify a chair, go from there. I wish you well. I appreciate you guys stepping up and volunteering to do this work. I know it's going to be a lot of work. I was part of the board doing this along with Steve more than a few years ago. So thank you. Next on the agenda. The next is the consent agenda. So what's in the consent agenda tonight is the approval of board meeting minutes from 5/18, the RRC reappointment of Mr. Burley. Oh, Dan. Oh, that's cool. So I know Dan, so he's up for reappointment on our RRAC, and then the hybrid meeting policy. So is there a motion to approve the consent agenda?
So moved.
And that was
Adam.
Thank you, Adam. Is there
This
a
is John
second?
Paul. I'll second that. This is John Paul.
Thank you, John Paul. Okay. There's no discussion on a consent agenda, so all those in favor? Oh, we have to do a roll call.
Aye.
I'm sorry, we have to do a roll call.
Yeah.
Sorry.
Okay, thank you. Ms. Bernard,
Yes.
Ms. Namie Dyer,
Yes.
Mr. Furman,
Yes.
Ms. Newman, Mr. Cowan,
Yes.
Dr. Hans,
Yes.
Mr. Torres,
Yes.
Dr. Guadalupe,
Yes.
Mr. Lindemeyer,
Yes.
Dr. Taub,
Yes.
Ms. Root,
Yes.
Mr. Landsman.
Yes.
Motion carries.
Thank you. So the consent agenda has been approved. Congratulations, Dan, for your reappointment. All right, next on the agenda is other business, the OCHN reopening plans. And I believe that is going to be presented by Edna White and Diana Bunch.
Good evening, everyone. My name is Edna White. I'm the HR Director here at Oakland Community Health Network. I've been with the agency since 2005, and I have been in the management role for the Human Resources Department since 2010. And today we'll be presenting information about the official reopening of the OCHN Troy headquarters. which will be on July 19th. I'm joined by Diana Bunchu, our Chief Information Officer, and the two of us have been part of a work group that's been in place for quite a while, managing the reopening and generally making sure that our organization is in compliance with the ever-changing landscape of rules from many different authorities at the federal, state, and local level. Next slide, please. So just by way of background of what's been happening with this pandemic and its impact on our operations in this building, the last day that we worked on site, that should be 2020, March 13th, 2020 was our last day that we had regular on-site operations in this building. We had planned to reopen for business on May 17th. However, we are all aware of the spike in cases that occurred throughout our county in March and April, so we pushed back the reopening so that we could observe the regulations that were put in place for the management of people working on site, and we have changed our reopening date to July the 19th. Next slide. So we're going to spend a little time talking about our building reopening work group. So around about this time last year, we had initial plans to look at bringing people back into the building around September. And with guidance from the CDC, Michigan Department of Health and Human Services, MIOSHA, the Oakland County Health Division, there were always new updates coming in. And we felt like it made sense to get a diverse group of leaders from the organization meeting on a regular basis to take in all of this information, understand what the requirements are, make sure we are in compliance with all of the regulatory requirements, while also understanding our organization, our culture, the requirement that we have to ensure that services and supports are delivered for community members, and understanding what we needed to do for our employees. So there's a lot to consider. So we had representatives from the HR department. I represented HR. Diana represented the IT team. We had our controller, Patrick Franklin, and our facilities manager, Mark Dugood, on that committee as well, and Christine Burke representing communications. And we worked together very well, I must say. Everybody was able to bring in their areas of expertise, and we got to be pretty good at understanding things that weren't even areas of expertise for us. So we took that guidance from CDC, MIOSHA, Michigan Department of Health and Human Services, and Oakland County. So that impacted things such as requirements for temperature screenings, signage that you see when you walk into the building. Do we have hand sanitizer dispensers? The floor markings. From the facility side, and ensuring that the refrigerators were taken offline so that people wouldn't be, putting food and touching surfaces. Also bringing in cleaning crews to take care of, sanitation. Many factors like that. Also, how do we respond when someone reports that they may have a potential COVID exposure? What are the rules that we have to follow in those cases? So we worked really hard to make sure all of our protocols were in place. And one tangible deliverable that we had was to produce the what we call the playbook. And that's a requirement from MIOSHA and also the Oakland County Health Division to make sure we have a written document that was shared with our staff, presented to our staff so that they are trained to understand where to go to look for information to protect themselves and their families. So we followed all of the guidance. We made sure all of the information in the playbook was customized so that it was applicable to us and the types of services that we deliver. Next slide, please. So for our building reopening on July 19th, we are requiring masks in common areas. We will be working in a hybrid model. So the hybrid model means that for people assigned to work in this building, half of the people will be coming in on a Monday, Wednesday schedule. We have others coming in on a Tuesday, Thursday schedule. And that's primarily for individuals who work at cubicle-style workstations. Individuals that have their own offices, so you're looking at members of the management team, they can come in any of the 5 days of the week or as many as they feel like they need to. So they are not restricted necessarily to a hybrid schedule. We are, for now, having people not report to the building on Fridays unless they have to. We are working to get more information on how to operate the RCC return to work in the safest manner possible. I don't know how many of you have seen, prior to the pandemic, the operations over at the RCC, but it's a much more compressed work area, so it's very difficult to have the social distancing setups that we have here in this building at the RCC. We also have more direct services provided at that location in Pontiac. So we are convening a separate work group composed of our clinical staff to advise and give guidance on how to ensure we can maintain safe operations at the RCC. As far as our presentations and trainings and events, those are going to be virtual until September 1st, so that we will still be able to deliver the trainings that we need for the people in the network, and we will start inviting people back on September 1st. I do need to make one point very clear. We worked on this presentation last week, and the plans are still in place for people to return on the 19th. I'm not going to tell you what I told Diana about how do you rip up a virtual document because it seems as soon as the virtual ink is dry, things change. So we knew that MIOSHA would be issuing additional guidance by July 1st, and they issued additional guidance today. So we do want you to understand that, we have a plan in place. It's been in place. We recognize that there are changes to the guidance on a regular basis, and we will do what we have always done. We will take our time, we will read the guidance, we will make sure we understand it, we will be compliant with the new guidance that's been issued, while ensuring that we can still get services delivered in the most safe way possible, while also ensuring that, our staff is well protected and are able to operate in a good environment as well. So we will take all necessary modifications that we need to comply with the new guidance and balance the need to deliver services. So that's pretty much my presentation right now. I would invite Diana to let me know if I missed anything, or are there any other insights you want to talk about from this experience?
I think it's been an exercise in learning how to be flexible, and I thought technology changed fast. COVID stuff changes even faster. Are there any questions for us?
Are there questions by the board?
This is John Paul. I have a question. What's the general consensus you get from staff on wanting to come back? I know a lot of people have anxiety about coming back into the office, and so it sounds like you're kind of, weaning it in here, 2 teams and 2 days a week, Fridays at home, everybody, unless you need to come in. So are people open to it, or is it, is there anxiety?
Well, we do have general staff meetings about every other week, and we give updates to staff, and they are, we get feedback in the chat right now, and we also issued an appeal for staff to, give us some feedback about how they feel about coming to the building. And I would say early on, there was a lot of concerns that people had. And I would say prior to the vaccine rollout, the response was all over the place. People wanted a little bit more time to see if they could, line up some vaccines. They wanted a little bit more certainty about what was happening in the child care arena, which continues to be a struggle. Pretty much just wanted more certainty. Now that we, have a good number of our staff who've been vaccinated, I think people are enjoying the opportunity to be able to come in on a hybrid basis. And we do have a recommendation out there to establish an internal work group that's not comprised of the same work group who's been working on the COVID response, but more directed in the idea that they would work together as a team to deliver a set of recommendations to our CEO about what it looks like going forward long term.
Yeah, that's kind of my next question then. So is there, I know September 1st you're talking about trainings in person potentially, and so many things change so quick with all this. So right now there's no target date though, is there, for everybody to come back at some point, or a higher bred different model or anything like that?
We're looking at it and we're following the science and following the state really to make sure that we're in a line. And our number one priority, of course, is keeping everyone safe and our staff. But the other thing on the other side of that is really making sure our presence is known in the community, especially as we face some of the legislative, challenges that we're faced with. We have to make sure that we're available and we can support the community and that they know we're here. The disadvantages is being in Troy, so we're sort of away from the folks that we serve. So as much as possible, I want us to get back into the community safely. So if something changes in terms of the standards and things of that nature with my OSHA or the CDC, we'll respond to that as needed. And of course, there are people who have really, really loved working at home, from home, and not having to dress for work and those kind of things. But the hybrid model does accommodate some of that, and I really wanted to make sure that people got back to the work environment and then look at some alternative work arrangements. But we also want to make sure we're being fair and that people have equal opportunity to take advantage of some of those things. Some of our teams are forward-facing or front-facing, so they really cannot be away from the community. They cannot work completely at home and never come to the office or never go out into the community. So we have to take all those things in consideration. And like Ms. White is saying, things are changing so quickly. So we didn't know we would have MyOSHA guidance today, but we did get it today. And so we're all wondering if we should wear a mask, take our mask off, those kind of things I think all of us are struggling with. But we want to make sure that our staff had enough time to address any of the other issues that may come up as well. And then the other part of it, we're hearing about this variant that's out there. So we still want to continue to support people and talk about vaccination, and then pay attention to that, because if it becomes a greater need and we go back into an emergency mode, we'll respond appropriately.
Are there other questions from board members?
Yeah, this is Vijaya. I have a comment. Please. I think although we see the light at the end of the tunnel, and especially in Michigan, the numbers are quite encouraging, but we are still in the middle of the pandemic is not over yet. The Delta variant about 2 weeks ago, United States was about 6% of the new cases. Today I heard it's 20%. And with the summer travel and people intermingling, the flights filling up, it's not over yet. So I think by probably early August, we'll have an idea where this is headed. And in September, I think when the schools reopen, it will probably be easier for working parents to address that important issue. So yeah, I agree. I think your plan is very sound, and it's flexible enough to accommodate the new guidelines as they change. And we still have to maintain our social distancing, masks, and hand washing, because this variant is very, very virulent. It's very easily contacted, and I have lost several family members in India recently, 2 deaths of younger people in the last 3 weeks. So we have to remain vigilant. Thank you.
Well, and I think one of the great things is that we have all of our documents and all of our procedures. So if we do need to go backwards, you know, it's going to be something that we're going to be able to do much more quickly and know what we're doing versus what we knew a year ago. If you would have said to Edna and I a year ago that we would still be talking about this, then we would have said, no way. So I think for us to be able to be adaptable, flexible, and quickly respond is really a key, as in what you're saying, Dr. Hans.
I just have one quick question. This is Sarah.
Sure.
It sounds like everything is very flexible and thinking about staff and particularly with those that are afraid to come back or maybe have that anxiety, I shouldn't say afraid, anxiety to come back. Has there been any issues with staff retention? Or, I mean, you hear in the news with folks leaving because they don't want to come back, so they're finding like 100% remote jobs or things like that. Are you guys seeing any trends where you're losing staff or having difficulty with retention?
Well, I would say we're not seeing staff, we're not seeing a staff exodus. We're seeing about the same turnover rate that we've been experiencing, but we certainly are aware of, the news reports you've been hearing is very prominent, not just in the everyday press, but it's a common theme in the HR newsletters, that I subscribe to, and SHRM and other leadership publications. So it's always out there. So what we have to make sure that we're doing, in addition to, ensuring that we have a workplace culture that's supportive of our employees, flexibility has been the key word throughout this entire pandemic when we talk about our staff. We had a lot of people work from home, as much as possible. We have, given people here and there, a little extra days off, things like that. We have frequent check-ins with our staff. We're doing what we need to do in order to be supportive of our staff. But, we understand the market. It is what it is, and it's a shift in what's throughout the culture. And it doesn't just impact OCHN. This impacts everybody. So as we look at coming back to the building, one of the things that, we talk about as a leadership team is we're not in this alone. We have partners at the state level. We have partners throughout the community at the provider level. We want to make sure that we have some semblance of being in sync with them so that we can collaborate, appropriately. And having that presence in the community is going to be really important. So the balance is what's key.
Thank you.
Jonathan, I had something as well.
Sure, Eric.
So I've only known this organization in a pandemic. I was effective April 1st. I do really appreciate you, Edna, setting the stage that the building was closed down. It'll be 16 months of operations in a pandemic with the office closed. And I don't know, how everybody did everything before that, but I have to say, it appears to me that it's important to acknowledge the staff. And there was, when you went to human resource management school, there was no course of managing in a pandemic.
It was a paragraph.
Right. And so for me, what I've observed in being with the organization is just extremely well-natured, willing to take on the ever-changing day-to-day things that were going on, the policies that were changing. I can't even imagine the conversations that were held with employees over the past over a year now. And that's not easy to do. And in the services that we provide, to try to have a seamless transition to the community from, being able to offer, services through people coming to work here and then transitioning to work at home. I know from a board member's perspective, I feel like the organization has made it very easy for us. And we were going through the process of hiring a new CEO, through the process of bringing on a lot of new board members. And to me, it just appears as though the staff has handled it terrifically. And I just want to acknowledge not only those of you that are here today, but every person that works in this organization in getting through one of the worst times in our country's history. And like it's been said earlier, it's not even over, right? And so I think you should be proud of the work that you've done as staff to do that. And I do agree that there's a changing expectation of the labor force. And there's going to be expectations on what appropriate wages are. There's going to be expectations on what working conditions are. And I hope that we're going to maintain that flexibility to meet what the workforce changes and the expectations are, because we do need to make sure that we are retaining and attracting the best and the brightest that we can under the circumstances. So thank you so much.
All right, thank you, Eric. I think there's probably no more board questions. I'd like to move on with the agenda, but I do want to say thank you guys for doing the work, especially in this ever-changing effort. Glad we have some IOSHA guidance. Okay, next on the agenda, our board reports. And John Paul with the Recipient Rights Advisory Committee, please.
Thank you. I attended the June 3rd Recipients Rights Advisory Committee meeting in person here at the OCHN building as the representative for the board on the committee. We reviewed applicants for the Recipients Rights Advisory Committee appointment, and we did agree, as you know, tonight on the reappointment of Mr. Burley. We received a presentation on site visit audits from Mr. David Hornbrook, and the presentation talked about the benefits of doing these audits, greater consistency in the application standards across the state, less duplication of effort, and greater overall efficiency for all the regions, providing individual benefits from reduced interruptions in the home, and some of the things that they look for when they do these site visits. They're looking at the general appearance, the medication compliancy, safety and contingency plans, staffing, incident reporting, recipients' rights, complaints. So there's a lot of questions asked. We have a really solid committee, representatives who are recipients of services, people like myself on the board who have been involved in other ends of it, and they were asking questions about how does the auditor, what kind of research do they do before they actually go out to a site, and thought it was interesting. They look at the LARA website, look at any investigations, reports, and things like that, which was good because what it does is allow them to, when they go to these sites, to kind of take special note of things that have happened in the past. So they're looking for specific things. One of our recipients said, I've been in a home and, they clean it all up right before they get there, and then it all goes back, and we know those kinds of things happen, unfortunately. So it was good to get that perspective from somebody who's actually been in one of these residentials, and have that input on that in the process as we were getting the presentation. So once they complete the site visit, they upload the documentation to the group site so that that information is available to the public and can be reviewed. So it's a very enlightening report on the audits. We received the presentation on boardables, and introduced the Recipients' Rights Committee to the process of how it would work in using it, and starting to move them into it. I shared some of my experiences as a board member working with Boardable, and I've had great experience with Boardable, and really have liked it. But knock on wood, wouldn't you know, my Boardable didn't work tonight. So out of all of a sudden, so I had to go the long way to the website. But it still is a very good program. I was hesitant, to it. I'm more of a paper pen type person. So I shared my experience on that end of that, I'm really glad that I transitioned over because I do like it and enjoy it. And I like the iPads as well. They seem to work well. We talked about Dan Moran Award nominations, which was a really big challenge because we had two applicants, Richard Eddington and Chanel Lee. Both are big advocates within the recipient community, really fight for advocacy and inclusion. We got the information, and it was really hard to make a decision because one applicant seemed to have more material presented than the other, so we didn't know if we had gotten a really good picture of the other person enough. So the committee did agree to have Ms. Suter go back and talk with Chanel Lee's nominator and get more information, and then we ended up deciding to recommend both applicants for the Dan Moran Award nominee. So, really encompassing that inclusion and advocacy. So that was very nice to make that recommendation. Site review report we had from Miss, and sorry if I chop your name, I always try to get it right, Pathfinder. We got that information. We've been getting it throughout the year on site visits. We're at about 45% of visits that have taken place, and it seems like it's been unique this year because it's being done virtually. And I wasn't sure if it still was being done virtually, but it is right now, or at least was as of early this month. So as you can imagine, they're going around and they're doing these site visits with I'm assuming, iPad or something, and the whole virtual format. But it's getting done, the best way that you can in the middle of a pandemic. With 45% completion, they do expect to have that completed like they do every other year. Just it's all being done virtual right now. The next meeting will be on August 5th. We will not have a meeting in July, so we have July off. But when we come back on August 5th, we are going to discuss more on education of guardianships and supportive decision-making process. That's been a big passion of our committee. Very interested, many people, in the whole guardianship, conservatorship, the rights of individuals, and the decision-making process. We will continue the conversation on site visit reports, getting more information. I'm sure we'll surpass the 45% rate that we're at now, and also be participating in our policy review. So that next meeting will be on August 5th. That is my report. Thank you.
Thank you. Are there any questions for John Paul? Okay, hearing none. Eric, did you have a oversight policy board meeting to report on?
No report.
No report. Thank you. And Malkaya's out tonight. All right, so next item on the agenda is our director's report.
Good evening again. This is Dana Lassenby, CEO. I do want to reiterate the appreciation I have for this team. And when I came in during the pandemic, you were absolutely right, Mr. Lindemeyer, that the team was working well. They had set up so many safeguards for the staff here. And so I have to call out IT had everybody ready to go remotely. HR, the facilities team is phenomenal. They stayed on site and continued to work. And as well as our clinical diagnosticians continue to do assessments for individuals needing autism services. So this team I walked in into, I inherited, is phenomenal, not let alone the volunteers during the whole time that passed out PPE under the leadership or direction of Ms. Burke, and then also the PPE, but also the vaccine clinics that allowed us to help individuals we serve, their families and their caregivers and the staff that support them to get vaccines. So I can't not go on without recognizing this incredible team that really made sure things went on and services continued. We had the support of the county exec's office as well as the board of commissioners to give out iPads for telehealth. So those are just a few things that continue to go on. So this is a great team, and we're just building on that. So I'm going to give my report very quickly. So out of respect for our time, I know that the past month probably, or a little more, we've been faced with some legislative proposals that are putting the public behavioral health system at risk. There are two in particular that are being looked at. One would totally eliminate the public system and privatize the system. The other is more of a one PHP or one administrative service organization. So just to make you aware of that, I probably talked to more legislators in the last month than I have my entire life, which has been good because I'm able to really advocate for the public behavioral health system and talk about our accomplishments and the things that we're working on that without the public system we would not be able to do. And those things really align with the priorities of MDHHS and the state as well as the county. So those things include access and crisis services, constantly working to improve that, as well as the integrated behavioral health care, integrated care, I should say, with our behavioral health homes, our certified community behavioral health clinics, as well as complex care coordination plans and programs that we have in place. We also are looking at improving the system of care for children and families. We have seen, I believe you've probably seen on the news, where you have children waiting in the ED for long periods of time. We're actively working on ways to address that. In fact, working with the county exec's office as well as area hospitals to make sure that we have relationships so that we can help individuals regardless of their funding source, whether they have private insurance or public Medicaid, to help them move along and get out of those EDs and those crisis centers as quickly as possible. Also looking at our provider relations and continuing with our value-based outcomes and contracting is one of the things that really makes Oakland a standout in the rest of the state. And we continue to advocate and work for our direct service professionals or direct care workers. And we also see a crisis that's really big and relates to some of the things that we talked about earlier, having to do with clinical staff and being able to recruit and retain a really essential workforce. So those are the priorities that I've set forth, and they do align, like I said, with the state as well as the county. And we're hoping to get their support, especially as it relates to the county in terms of funding some of these programs. So we can, programs that we need to build upon, we can build upon. Programs that we need to make stronger, we can do that, especially as we look at crisis intervention training and the co-responder programs. Some of the things that are at risk if the system gets privatized is the community mental health system itself as a safety net, our ability to have person-centered planning and coordination of care, community-based coordination of care with a full array of services, community living supports. If you look at the residential services and how we support individuals living in residential settings, that is critical. Employment programs, as well as housing assistance. Those are just a few of the things that would get lost if you privatize the system. And then, as I said before, the justice diversion and our ability to keep people out of jail and provide services and supports. So we're looking at a solution focus. We're just not going to legislators and saying, don't do this. We want to give them solutions, alternatives, and various different programs to really shine a light on the positives of the public system. I think we see a lot of negative attention brought to the public mental health system, behavioral health system, and we really want to shine our light and really have a voice and a seat at the table so that legislators are not making these decisions without people served and without our input. So that's our continued real fight at this time. And we, like I said, I'm talking to legislators every day. So if you have relationships with them, please reach out and advocate for us. You are our ambassadors. We appreciate everything you do. And I think it's important that they hear from you. And so I have some sites in my report that you can link to make sure that you know how to contact and give you some of the elevator speech of what kind of things you can say to really get the story in front of them and have them understand what's at risk here. The other programs I want to highlight, and I do not take any credit for these things, this is the leadership team and their teams that have worked on a peer respite program, and these are grant-funded programs. The peer respite actually is a peer-run respite program called Hope 365, and we're helping this individual really get it up and going, and it's a diversion opportunity, so people would necessarily have to go inpatient, and we can look at crisis service recidivism. So instead of having people sit in the ED or sit in a crisis center, there would actually be a program where they could go and get the services and supports they need as opposed to going in the hospital. And then we have PPE grant funds, and so we continue to pass out PPE. And then the Children's Crisis Stabilization Grant. I went over that a little bit earlier about children's system of care and really making it stronger. We know when children need services, many times they need intervention through various systems, education, and other systems. So we want, in the Department of Human Services, DHS, so we want to make sure that we have a program set up so that when we have children and family in crisis, there's a place for them to go and receive those services and supports. We have not heard back from this grant application as of yet. They have asked us additional questions, so we think that may be hopeful. So as soon as we find out about these programs, we will definitely provide an update to this board. And again, I want to welcome our new Chief Clinical Officer, Ms. Kimberly Flowers. And I hate that she's on the end of my report. I started to say that first, and she's just been a great addition to our team already. And she comes with us with very extensive and comprehensive experience in leading our clinical best practices and looking at some of those gaps that we've identified that we really want to make stronger. And this is going to be good for us as a public behavioral health system, because when we go to the state and we go to the other legislators and really understanding we are the best and we have a lot of practices that could be modeled for the rest of the state. So that's it for my report.
I have lost Dana. I'm not sure if anyone can hear me, but the next item on the agenda.
I can hear you, Jonathan.
Okay. Thank you. For whatever reason, I lost signal. It said I was offline and it's back. Thank you.
Yep.
All right, next item on the agenda is board comments. I'm wondering with the late hour if there's any board comments. Oh, public comment, sorry, public comment. All right, not hearing any. If there are no board comments, I'm looking for a motion for adjournment.
Is there a second?
Jonathan, I'm not sure if we lost the boardroom or not.
I'm sorry?
I'm not sure. This is Adam. I'm not sure if we lost the boardroom or not.
We may have. So, and you and I are both virtual tonight, correct?
Yes.
Well, I'm on also. This is Dennis.
Hi,
So
Dennis.
I'm on the phone. So
Yeah, I'm virtual as well. I can hear you.
Okay.
And I'm virtual.
All right. I think they're going to catch on that they are alone in a room. We are all alone on our own little islands. So, all right. I want to thank you all for participating. For those had asked for and Adam for signing up for the I'm sorry, had asked for signing up for the work effort for the committee. Adam, I know, no, you didn't. I'm looking at my list. It's John Paul, Rena, Hadass, and Dr. Hahn.
Correct.
Okay. But again, thank you guys. I will not be at Thursday night's study session. So I wish you well with that. I'm on an airplane at that hour, otherwise I can't.
Okay. Jonathan, I think hopefully whoever is, I off the top of my head don't know who the vice chair is, but hopefully they can pick it up and close out the meeting. And we can correct it at the the next meeting in the minutes as to adjournment and all those kinds of things.
Well, I'm texting Sarah right now. So I'm going to call this meeting adjourned. How's that? Since we all know, and I'll do